My name's Mark Priestley. I'm an anaesthetist at Westmead Hospital in Sydney. I'm currently the head of department there, and I've been working as an anaesthetist for 30 years. I got my FANZCA 30 years ago, and I've loved every minute of my job ever since then. I mean, I joke and say, well, we start with conversation. If that doesn't put people to sleep, then I try medication. But seriously, I think the easiest way is when I say to people, we give medication that stops all the brain cells talking to each other, and that, from your point of view, it means that you lose consciousness. And importantly, we might need to add a few things that make sure you stay still so that the surgeon can do their job. That tends to cover most anaesthetics. Often women having a baby want to know how it works, and really it's the same thing, except we're just giving drugs that stop the pain fibres talking to each other so that they don't feel what's going on when they're operating on the part of the body that you can't feel. I think the most important way is to briefly explain, as simply as possible, what it is that we do, but importantly to listen to them and ask if they've got any questions. And sometimes they'll have a lot, sometimes they don't. Sometimes you can pick the body language that says actually they might need some more reassurance. Some people don't want to know anything. And so it's really tailoring your conversation to the individual. Well, I think it's important that people can be great in different ways. We have fantastic researchers, we have fantastic people who are good educators, but really, in the patient-facing sense of it, I think having empathy for the patient's feelings and what they're going through, and understanding what the needs are of the patient and also the surgeon, and being able to meet those needs, not just with empathy and compassion, but also with good skill and with diligence. I think vigilance and diligence is extremely important in anaesthesia, attention to detail, and also having an aptitude for dealing with crises or difficult times without getting flustered. I think that's really important, and a good anaesthetist is usually able to handle a complication of any nature confidently and with a sense of control that should be very reassuring to most patients. I still get excited by the job. I love the rate of change in medicine, and because anaesthesia is connected to so many different specialties, not just surgery, obstetrics and cardiology and gastroenterology, there's so much change in medicine, and really anaesthetics is about enabling good people, good specialists, good proceduralists to do their job. And sometimes it's fantastic to see a heart operation go well, or the delivery of a baby go well, or a small child have something very simple fixed up. I love it, and it's exciting every day. Anaesthetists, because they're team members almost by definition in the operating theatre or in the other parts of the hospital in which they work, can often get a very good sense of how the whole system works, and that puts them in a very good position of taking leadership roles, whether it's leading the team in the operating theatre or a trauma team or a resuscitation team on the ward, right through to managing teams in hospitals. And more anaesthetists are now taking roles in the hospital environment, right through to general manager, CEO type leadership roles, and being very effective because they understand how different parts of the hospital work, and they tend to live in the hospital and want to see the whole connected, integrated healthcare system work well. So it's a great place for anaesthetists, and it's something I'm passionate about.